Following the doctor's note, a new law in Washington is aimed at protecting access to preventative health care. Governor Bob Ferguson signed House Bill 2242 into law last week.
It is a measure that some state leaders say will help ensure that people can keep getting certain preventative services through their health insurance, even if there's uncertainty at the federal level. I talked with our state's health secretary, Dennis Worsham. Obviously, the legislative session has wrapped up, and we're here to talk about House Bill 2242. Simple terms, what does this law do?
Yeah, we call it the Preventative Services Bill, and the intent of it is to assure access and affordability to preventative services, including vaccines.
Okay, and this law focuses on that type of health care, preventative. What kinds of services are we talking about when we're talking about preventative?
Yeah, so vaccines is clearly called out in the bill. The other parts are really preventative screenings, like well-child screenings, it's like cancer screenings, it's like mental health screenings. It's really about the preventative areas, and they're required to be covered in insurance, and they are built into the bill on the front end.
You and I have talked in recent months about some of the uncertainty at the federal level,
right,
which has created some concerns on the state level. Certainly that's been felt here in Washington in recent months. What concerns were lawmakers trying to address by passing this bill in Olympia?
Yeah, two things in particular. One is what we've seen on the federal level around the vaccines is currently there's been slight modifications within those areas, but they have not pulled them off of the recommendations list. And they may have shifted the guidance a bit. The thing that's really important to understand around what the ACIP does is not only the recommendations, it also is the purchasing power. And that purchasing power is in a universal healthcare system that we have around vaccines for kids, is they purchase also our vaccines at a very low rate that comes into the state. If that changes, it really hurts our ability to be able to afford those vaccines. So what this change happens is it allows us around keeping those on the insurance cards, keeping those paid for, so that when people do want vaccines, we're guaranteed that they have a way to be able to do that, as well as the preventative services that CDC puts out.
That makes more sense. Some viewers might wonder why their insurance should cover services that they personally don't use, for example. How do you explain that?
You know, that's just how insurance works, right? I mean, I pay car insurance, you pay car insurance.
Yeah.
I may have never been in an accident, right? Yeah. But that's how you pay into the pool. It's certainly the same with healthcare. I've been fortunate in my life. I've never had a surgery or hospitalized, but I pay a premium, and that covers for people to do it. So it's a good thing that it does, that allows affordability for other people who need those services when they need them.
Covers those what-ifs that you hope never have to come throughout a lifetime. Who, in your mind, benefits most from this law being passed?
Yeah, I would say, you know, just from the societal level, it's really important that, like on vaccines, is that we make sure that everybody has this universal protection within our communities. We've heard the comment herd immunity, right? And it's really that it protects everybody and interrupts the transmission of disease. So incredibly important for the whole society on the vaccine side. On individuals, high-risk people, I have in my own family, right? I have family members who have had breast cancer. My grandmother, my mother, my sister. Those early detection screenings are incredibly important for individual people and families as well.
Yeah, very, very preventative care, and it helps in the long run. Secretary, thanks for your time.
Yeah, thank you for
having me.
Yeah, good to see you.